Hello, welcome to my channel. My name is Bridget. In today's video, I'll be going over 5 fundamentals NCLEX style questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. A 39-year-old client is talking with the nurse about the client's sexual relationship with a committed partner, which describes how the nurse should discuss an awkward topic with a client. If you've watched my other videos, this is actually a repeat on another video. The answer is state that it is normal to feel awkward discussing this topic. These questions just pop up randomly. I don't select them. And you can pause to read the rationale. In my previous video where this question also popped up randomly, I stated that you don't really bring in another professional unless you're doing something and you want to protect yourself also against litigation. Things like examining a male patient if you're a female, if you're examining the testes, or a gynecological exam. You usually want to have another person in the room. A client is undergoing a blepharoplasty. Which of the following is the most appropriate description of this procedure? If you think of like blepharoplasty, it has to do with the eyelid. So the prefix is what's triggering me to pick surgical suturing of the eyelids. Yes, so the prefix blephar is the eyelid. So that's where knowing your prefixes can help you even if you're not sure what a blepharoplasty is. The perioperative nurse is creating a sterile environment and is aware that sterile drapes create the sterile field. The nurse knows that which of the following is true of sterile drapes. Select all that apply. Definitely you need to check for holes or tears in the packaging before applying. Sterile to sterile, essentially. Once sterile drapes are applied, they should not be moved. So sterile drapes are also used for instruments and supplies, so that's why that one was not correct. And of course, like, you still need to see where you're operating. So the operative area should be able to be seen once the drapes are applied. You can pause to read the rationale. The good thing about nursing.com is that they provide videos also. If you missed a question and you're not sure why, they have lessons and videos so that you learn. The clinic nurse is assessing a 17-year-old client's management of asthma. The nurse notes that the client is not ready to transition out of pediatric care and into adult care based on which of the following. One element of transitioning to adult care whether the pediatric client is able to adhere to the current treatment plan. If a pediatric client is not following recommended treatments and management, they are not ready to transition to adult care. Which of the following clients is the most at risk for developing sepsis? 94-year-old with pneumonia and a temperature of 102, 55-year-old with gluten intolerance and a temperature of 100, no, a 2-year-old who is teething, 34-year-old with chickenpox and tachycardia. It's going to be the 94-year-old. You can pause to read the rationale, but she has a extremely elevated temperature. 100 we're not really that concerned about, but 102 and she's 94, she's the most at risk. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.